Welcome to Effectively Partnering with Rural Communities for Public Health Communications course. My name is Esmeralda Salas, and I am a research associate with the Population Health Innovation Lab, a program of the Public Health Institute. Thank you for being here today. I'm excited to guide you through today's lesson and explore the content together. Before we get started, I want to share a few important acknowledgments and disclosures. This course was developed with support from the Centers for Disease Control and Prevention, Office of Rural Health, through funding provided under CDC RFA PW 240080. CDC, along with their planners and content experts, would like to disclose that we have no financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Additionally, the content in this course will not include any discussion of products for unlabeled use or products under investigational use. Finally, CDC did not accept any financial or in-kind support from any ineligible company for this continuing education activity. With that context in mind, let's talk about who this course is designed for. This course is designed for individuals who may not directly work in rural settings, but are involved in rural public health and seek to deepen their understanding of collaborating with rural communities to enhance public health communication strategies. For example, participants may include federal level or state level public health staff developing communication campaigns or policies that impact rural populations, nonprofit program managers supporting rural health initiatives, hospital system outreach coordinators working with rural communities, consultants providing strategic support to rural clinics and health departments, nurses working in rural communities, and many others. Now that we've identified who this course is for, let's look at its purpose. This course seeks to deepen participants' understanding of how to effectively partner with rural communities to enhance public health communication strategies by focusing on building relationships with rural communities, planning, developing, and disseminating tailored public health messaging for rural audiences, and collaborating with community partners throughout the communications process. So how will we achieve these goals? The course features a combination of practical tools and real-world insights. You can expect strategies and resources. You'll find tools and approaches you can use to support your public health communication efforts. You'll also find real-world examples. Throughout the lessons, we've included scenarios and stories drawn from rural communities to help illustrate various concepts and strategies. You'll also find insights gathered from rural health community members and experts. You'll hear directly from those doing the work, such as rural health community representatives, public health practitioners, rural experts, and other experts whose experiences shape this course. Their voices, gathered through a series of interviews, are highlighted throughout the lessons to deepen your understanding of partnering with rural communities. You can also expect integrated workbook activities. At the end of each lesson, we'll guide you through activities from an accompanying workbook. These activities are designed to help you reflect, plan, and apply what you're learning in a way that's relevant to your work. This course is structured into 4 lessons. Lesson 1 lays the foundation by exploring the importance of collaborating with rural communities. Participants will learn why these partnerships matter and how to practice active listening and relationship building to foster trust and more effective communication. Lesson 2 focuses on co-developing a public health communication strategy with rural communities. Learners will walk away understanding the core steps of strategic communications, how to assess community needs and assets collaboratively, and why rural voices are essential in the planning process. Lesson 3 dives into developing public health messaging that resonates with rural audiences. Participants will learn how to craft linguistically and contextually responsive messages, and how to meaningfully involve community members in message development to address community health and resilience needs. Lesson 4 closes out the course with strategies for dissemination. Participants will identify ways to share public health messages with rural communities, such as ways that build on local leadership, or promote informed decision-making, and ultimately contribute to better health outcomes. Today, we will be jumping into Lesson 4, Disseminating Messaging. In this lesson, we will explore how to partner with rural communities to effectively disseminate public health messages. This lesson builds upon previous concepts from earlier lessons and brings together everything you've learned so far. By the end of this lesson, you'll be able to identify communication dissemination strategies that can support engaging rural communities, identify strategies for collaboratively disseminating public health messages with rural communities that build trust and respect community leadership and expertise. And lastly, you will be able to recognize ways public health communication can support informed decision making and improved health outcomes in rural communities. Here is how we will get there today. To begin, we will start with a quick review of the essential steps of strategic communications, with a specific emphasis on steps 6 through 7, which are delivering the message and continuing to review and revise. From there, we will move into a discussion of lessons on delivering public health messages, drawing directly from the experiences and insights of rural community members and experts. Next, we will highlight examples from the field that showcase effective strategies for delivering rural public health communications. After that, we will spend some time diving deeper into specific strategies and tailored resources that can strengthen your dissemination efforts further. Finally, we will conclude our lesson by connecting these key concepts to the activities and tools included in your course workbook, giving you an opportunity to apply what you've learned in a practical and actionable way. Before we move into the main content of this lesson, let's take a moment to pause and reflect on a few questions to get us thinking. Think back to a time when you witnessed or were part of a communication effort that really worked. It doesn't have to be anything formal or related to public health. It could be something as simple as your family sharing important news, your group of friends planning get-togethers, or your community organizing something that mattered. Ask yourself, what dissemination strategies made this communication effort successful? Was it the way that the message was shared? Maybe through a group chat, social media, a flyer, or just good old word of mouth? Did the message feel personal, timely, or easy to act on? We're starting with this reflection because sharing messages isn't limited to specific ways or places. It happens all around us every day. The strategies that work in our personal lives can often teach us a lot about communicating effectively in other settings, including with rural communities. So take a minute to press pause and think about that example. When you're ready to continue, press play and we'll continue with the lesson. Let's take a moment to review the essential steps of strategic communications. Here are the essential steps of strategic communications. In our previous lessons, we explored steps 1 through 5 of the essential steps of strategic communications for rural public health communications. Let's briefly revisit these steps and the lessons where we covered them so we have a strong foundation moving into today's content. In Lesson 2, we focus on the first 3 steps. The first step, goal setting. We discussed how clearly defining your communication goals provides a strong foundation for rural public health communications. Understanding why you are sharing information with the community helps clarify the intended outcomes and purpose of your efforts. Step 2, understanding the audience. Building on goal setting, we explored how to identify and analyze your target audience. This step involves specifying desired takeaways, as well as understanding the communication needs, preferences, and context of rural communities to tailor messaging effectively. Step 3, building a communication strategy. With clear goals and a well-understood audience, we learn how to begin building a communication strategy that outlines the key messages, channels, timelines, and resources needed for rural public health communications. In Lesson 3, we built on this foundation with the next 2 steps. Step 4, developing messaging. Here, we focus on crafting clear, compelling, and contextually aware messages with rural communities while aligning with their communication goals. Step 5 is seeking input. We emphasize the importance of gathering feedback from both internal and external audiences. This step ensures that messaging is accurate, relevant, and sensitive to the needs and perspective of all rural community members and organizations. If you missed these earlier lessons or would like a refresher, we strongly encourage you to revisit lessons 2 and 3 before moving forward. Now, as we transition into Lesson 4, our focus shifts to the final two steps of the essential steps of strategic communications. Step 6, delivering the message. We will explore strategies for effectively disseminating public health messages through the right channels and at the right time. After all the careful planning and messaging development, this step is about execution. How do you get your public health message out in a way that engages and motivates rural communities? Step 7 is continuing to review and revise. Finally, we will discuss why communication should be seen as an ongoing process rather than a one-time event. We'll look at ways to monitor the effectiveness of your communication efforts, gather new insights from rural community members and organizations, and adjust your original communication plan and messaging content as needed. This iterative approach helps ensure communications remain responsive, relevant, and impactful over time. In the next sections, we'll dive into these two final steps. We'll share practical tools, real-world examples, and actionable strategies to help you successfully deliver your message and adapt based on feedback and new evidence. Let's begin by exploring Step 6, delivering the message, and uncovering lessons in how to effectively disseminate public health messaging. As we consider how to partner with rural communities to effectively disseminate public health messaging, it's helpful to reflect on what we've learned from previous efforts. Taking a step back to review these lessons allows us to see patterns, identify pitfalls, and recognize strategies that truly work on the ground. Understanding what works and what doesn't on the ground is essential for effective public health communications. Previous lessons from on-the-ground partners, experts, and others provide valuable insights that go beyond theory, helping us adapt strategies to real-world contexts, build trust with communities, and improve the relevance and impact of our messaging. Before we dive into a specific example, let's take a moment to highlight a few key insights gathered from conversations with rural health community members and experts. These insights will set the stage for understanding how to approach message delivery in a way that resonates. Lesson 1. Top-down approaches often don't work. One key lesson is top-down approaches are often ineffective in rural communities. Always seek community input before disseminating rural public health messaging. Top-down dissemination approaches typically involve externally developed messaging shared without meaningful community input. In rural communities, these approaches frequently fail to resonate for several reasons. Lack of local input is one of those reasons. Messaging created without engaging rural partners may not reflect the language, values, or concerns of rural communities. Dr. Neetu Abad, Senior Behavior Scientist at Center for Disease Control and Prevention, shared a powerful example from COVID vaccination efforts. There were mass vaccination sites during COVID. Some of those were stood up really fast, and they did the best they could, but sometimes they would staff them with personnel that the community did not really trust, and their mass vaccination sites would fail. And they would have to close them, and it would typically take a lot of funding to stand them up because they just didn't have the demand there. They didn't have the community showing up to those places. And some changes would make it better. If you had consulted with community leaders on where to put a site, or who to staff it with, or how to socialize the idea that there was going to be this mass vaccination campaigns. When folks started doing that, like doing more socializing, you just saw an increase in demand for that service. That's something you should have done, probably in the beginning. Another common characteristic of top-down dissemination strategies is use of technical jargon. Messages often assume that all audiences within rural communities understand public health terms, overlooking the need for clarity, plain language, and translation, thus alienating those unfamiliar with such language. Additionally, top-down dissemination strategies emphasize compliance over collaboration. Communications framed in authoritative or fear-based tones can overlook the importance of dialogue and autonomy of rural communities. An example of this can be something like, "You must get vaccinated to protect your community." One rural public health partner explained, "I think maybe just drilling down to understanding the audiences, and how they like to receive information, not overlooking some of those tried and true channels, traditional channels for communication. Lastly, another characteristic of top-down dissemination strategies includes one-time outreach with no ongoing engagement. Messaging efforts that are one-off or transactional, especially without follow-up or ongoing engagement, do not build the trust needed with rural communities for lasting impact and may be perceived as impersonal or opportunistic. Another important lesson is to avoid using a one-size-fits-all approach. Strategies effective in urban areas often don't translate directly to rural communities, which vary widely in terms of geography, language, economic conditions, and identity. Trying to use a one-size-fits-all approach can result in approaches that feel disconnected from lived experience. Daphne Johnson Clark, Public Information Officer at Upper Missouri District Health Unit, highlighted this point. Well, I think it's many things I've talked about. It really is like it takes more time, probably, but it is finding those little things in a community that you can go out and do. It's the flyers at the elevator and flyers at the Sunnex gas station, an international grocery store, and putting information in a church bulletins, which doesn't cost us anything and it gets out to a good chunk of people. Furthermore, historical patterns and limited engagement with external institutions can create distrust, making messages from external institutions less well received. Kate Downs, program manager at Seven Valleys Health Coalition, described this challenge. There's also a lot of mistrust in communication that comes out from different sources, especially government. So there's just a lot of hesitancy. In my experience, rural folks don't love to be told what to do. So it's finding that fine line to walk where you're giving them the information that is helpful and helps keep them safe. You're not telling them what to do because that creates resistance. But it's critical information. So what does work? We've learned that effective dissemination of public health messaging in rural communities is grounded in trusting relationships, local knowledge, and community participation. Some proven strategies include partnering with trusted local leaders you've likely already identified and or collaborated with throughout this process. This includes pastors, teachers, farmers, tribal elders, community health workers, and other local leaders that can serve as trusted messengers who possess deep contextual understanding and established credibility within rural communities. By collaborating with them, we ensure messages are communicated in ways that align with local values and ways of knowing. Another strategy is respecting traditions and linguistic norms. Using local language or dialects and honoring oral traditions and storytelling enhances relevance and impact. Nancy Etch, Infection Prevention Coordinator at CDHD, explains the importance of working with the team to ensure information is disseminated in a way that respects traditions and linguistic norms through the following quote. We're starting to do HIV messaging and communication. If only you have one person doing it, that's hard. We have 4 bilingual health educators on our team. Oh my gosh, what they came up with is so amazing and so great. So what I'm trying to say is to have a team. If that one person in rural areas doesn't have a team, connecting them with the team is really important. And bilingual is so important. Again, our rural health areas are diverse. An additional strategy is using the channels and community spaces residents already use. Messages are often more effective when shared in everyday community spaces, such as church gatherings, volunteer fire stations, livestock auctions, and potlucks. Events such as health fairs, town halls, community fairs, and sports games also provide informal yet impactful platforms for dissemination. In many rural communities, traditional media platforms like local radio, community newsletter, bulletin boards at grocery stores or gas stations, and word-of-mouth communication remain vital. In addition, digital platforms such as local Facebook groups or WhatsApp lists can be useful for disseminating messages in a way that aligns with community norms and preferences. Dr. Neetu Abad, Senior Behavior Scientist at CDC, illustrates this approach sharing. I was down in South Georgia working with a pastor who had a lot of folks in his community that he was speaking to, and we would talk about ways that he could promote health services through his communications with his community. That could be one-on-one, or it could be like a group setting, but it didn't involve printed material. It involved what he was saying verbally. Daphne Johnson Clark, Public Information Officer at Upper Missouri District Health Unit, also added, in some of our really rural areas, there's a benefit of you know exactly where they're going for their sources of information. So you know if there's only one newspaper in that county, probably the majority of people are seeing that at some point. If they only have access to one radio station, then you know that you have this little pocket where information is gathered that you can make sure you can get information out. Then you also know where the coffee gathering is that everybody's going to, like the farmers that go and have their little coffee group before they go out and start working kind of thing. And you can get information to there and make sure that it gets out to that community. So I think that's a benefit, is that we're able to target specifics of where we can reach them. These examples highlight the importance of using familiar spaces and trusted voices to amplify messages. Now let's look at real-world examples that bring these strategies to life. Seeing these ideas in action can help us better understand how to apply them in our own work. Our first example is the Coffee Break Project. The Coffee Break Project, run by Valley-Wide Health Systems in southeastern Colorado, helps farmers and ranchers check in on their mental health through a public awareness campaign and twice-weekly informal gatherings with free coffee and donuts. The project began by teaming up with local businesses to host monthly giveaways of practical items like coolers and stadium chairs, a simple way to engage people while building trust. From there, the project maintained momentum through creative outreach. For example, they used bumper stickers, dove around handing out lunchboxes filled with snacks and resources directly to workers in the field, and even set up a traveling display asking, "Do you look after your neighbors as close as your crop or herd?" Its outreach materials highlight logos from 9 well-known local and regional partners, such as a seed supplier, livestock commission, family farm, and tractor dealerships. By involving trusted community organizations, the project not only spread awareness through multiple channels, but also reduced stigma and built trust among farmers and ranchers. Next, let's turn to an example from California's Coachella Valley Unified School District. This district, serving several desert rural communities, established wellness centers for students across middle and high schools in 2022. These centers served as trusted spaces where communities can learn coping strategies, connect with supported adults, and access mental health resources in a familiar school-based setting. At Desert Mirage High School, for example, students can explore a bulletin board filled with accessible mindfulness techniques. Notice how this simple visual communication tool empowers students to choose strategies that resonate with them, meeting them where they are at both emotionally and physically. By integrating mental health promotion into daily school life, the district reaches youth in a natural and stigma-free way. Shifting focus to public health communications during the height of the COVID-19 public health emergency, a variety of public health communication strategies were used to reach different communities. The COVID Collaborative teamed up with the Ad Council and trusted rural voices, such as the American Farm Bureau Federation, the Cooperative Extension System, and others, to launch a series of public service announcements tailored specifically for rural Americans. Here's an example of one of those PSAs.
Lord, I know that you are watching over me.
I'm active in my church. Faith is important to me.
My son played baseball since he was 3. I've closed a lot of deals sitting on the third baseline, sister.
When COVID came out, I was a total skeptic. I work out. I didn't take that vaccine when my husband did. Then I'm in excruciating pain. He took me to emergency. I said, "Can I please get vaccinated?" She said, "Sorry, a little late for that." We don't talk about lasting effects of COVID. It's been 65 days.
Still have myocarditis, gotta have another echocardiogram.
There is misinformation out there. This changed my thinking. Make your own choice. Make an educated one.
My echocardiogram showed my heart doing well. I'm cleared to take the vaccine.
We all want to be healthy.
The antidote for fear is thankfulness. I am thankful for this. I'm thankful.
For our final community example, let's explore the Healthy Man Michigan campaign, an example of effective rural public health communications highlighted by RHI Hub. This campaign addressed mental health issues, particularly depression and suicide risk among working-age men in rural Michigan. Recognizing barriers like social stigma and norms around masculinity, the campaign used online screening tools that allowed men to confidentially assess their mental health, receive immediate personalized feedback, and access local and national support resources. For men who met inclusion criteria, the campaign offered invitations to participate in a voluntary paid study evaluating online mental health interventions, creating both a resource and an opportunity for engagement. The campaign built a statewide coalition and collaborated with a broad range of trusted community partners to extend its reach, including male-dominated industries and labor groups such as construction, rail, emergency services, and unions, veteran organizations and professional sports teams, community hubs such as fitness centers, hunting and boating clubs, and barber shops, faith-based organizations, fraternities, and men's social clubs, support services including housing, legal aid, unemployment offices, and financial assistance programs, casinos, which are common social gathering places in some rural areas, and employee assistance programs within workplaces. What made the Healthy Men Michigan campaign particularly effective was the strategic multi-channel dissemination approach. It combined grassroots outreach with digital platforms and used messaging tailored to resonate with its target audience through masculine, relatable language and imagery. Dissemination efforts included tailored social media outreach via Facebook, Instagram, and Twitter, email newsletters, webinars, Twitter chats, and digital advertisements, press releases, media interviews, and public service announcements, earned media coverage in news outlets, and free printed materials for partners, including posters, flyers, wallet cards, and brochures designed for discreet, easy distribution. Taken together, this campaign illustrates several essential strategies for successful rural public health dissemination, including delivering contextual messaging, disseminating messages that reflect the values, language, and realities of rural men, ensuring they feel understood. Additionally, we also see trusted partnerships, such as engaging with local institutions and community leaders to enhance credibility and reach. Another strategy is multi-channel outreach, combining digital, in-person, and printed methods to meet people where they are at and increase accessibility. In summary, the Healthy Men Michigan campaign provides a strong example of effective dissemination in rural public health settings. Now, take a moment for reflection. Think about a rural community you're familiar with or have worked in. Ask yourself, how could the strategies used in the Healthy Men Michigan campaign, such as trusted partnerships, contextual messaging, and multi-channel outreach, be adapted to effectively address a local public health challenge in that community? Take a few minutes to jot down your ideas. When you're ready to continue, press play and we'll continue with the lesson. Now that we've reviewed examples from the field, let's shift our focus to some strategies and resources you can use for disseminating public health messaging. As we move from seeing what's been done to thinking about how we can apply it, we'll start by examining the key elements to consider when disseminating public health communications. It's important to remember that disseminating public health messages in rural communities involves much more than delivering information. This is not a one-way transmission. It's a two-way collaboration. In other words, public health messaging and dissemination must be developed with, not just for, rural communities. In this course, we've introduced a framework with multiple steps. Before we dive into examples of strategies, let's take a moment to revisit this framework. Although these steps are presented in a linear format, In practice, they are nonlinear, continuous, and iterative. Steps 1 through 5, establishing goals, understanding the audience, building a communication strategy, developing the message, and seeking input, require time, trust, and mutual engagement. These are not simply boxes to check off before moving on to message delivery. Rather, they lay the groundwork for what we're calling partnering with rural communities to disseminate public health messaging. Ultimately, our goal is to reframe our role from delivering information to rural communities to delivering information with rural communities. So, what strategies can we use to collaboratively disseminate public health messages with rural communities? Let's explore several strategies we've learned from partners in the field. This includes engaging trusted messengers, partnering with local leaders, and training and supporting partners to lead their own campaigns. Another strategy is using familiar communication channels. This includes local media, radio, interviews, newspapers, newsletters, digital platforms, Facebook groups, listservs, text, WhatsApp updates. Additionally, we can use community spaces for disseminating messages. We can disseminate messages in high traffic spots, such as diners or food stores, at local businesses, and at events such as fairs, games, and markets. These strategies are offered as examples to inspire local adaptation and expansion based on community needs, assets, and communication goals. A valuable resource to support these efforts is the Johns Hopkins Bloomberg School of Public Health and Center for Communications Programs, a field guide to designing a health communication strategy. This guide provides clear steps and tools for health communications planning, including guidance on selecting the most appropriate communication channels. Many dissemination strategies outlined in our course highlight the importance of planning and tailoring your approach to fit the characteristics of the rural communities you're working with. One of the first steps in disseminating public health communications is identifying existing communication channels and understanding the audiences they reach. Worksheet 1.38, Health Communication Channels, can support this process by letting you identify mediums, define audience reach, and document how you learn about each channel. If you're unsure about what channels may exist in the rural communities you're partnering with, a helpful starting point is Worksheet 6.1, a typical day in the life of the intended audience. This tool helps map out where your audience spends their time, whether at home, at work, and during leisure, and reveals key touchpoints for communication. It's important to complete this activity in partnership with community members to ensure accuracy and capture contextual nuances. Here's an example of a completed day in the life worksheet. Notice it doesn't need to be exhaustive. It's a starting point to think more intentionally about how and where to connect with your audience. You can also use Worksheet 1.3c, Health Communications Assistance, to identify individuals, organizations, or institutions that can support your communication efforts. As emphasized throughout this course, effective public health communication in rural areas must be done in partnership with trusted local partners. As you begin narrowing down which channels to use, it's important to critically assess their effectiveness. Not all channels are equally efficient or credible, and what works in one rural setting may not work in another. Worksheet 6.2, Evaluating each communication channel, supports this assessment by guiding you to define the type of channel, identify the audiences it reaches, estimate the cost per 1,000 people reached, rate the channel's credibility from the perspective of your audience, consider factors such as language, tone, visual appeal, and access. You can also check boxes to indicate which channels offer a balance of high efficiency and strong credibility, both of which are essential in rural public health communications. In summary, these worksheets, from identifying local channels to evaluating them, can be used together or separately depending on your team's progress and your knowledge of the community. When used in collaboration with rural community partners, they help build a strategic, community-informed dissemination plan that's more likely to resonate and have impact. Through interviews with individuals working in and with rural communities, we learned that a wide variety of dissemination approaches are used, and each are thoughtfully tailored by considering target audience, community partners, dissemination channels, timing, cost, and other factors. Here's some illustrative field examples. Sharing mental health resources at veterinary clinics to support those grieving a pet or facing pet-related challenges. Partnering with other communication professionals to exchange resources and amplify messaging efforts. Reaching parents in school settings through students or PTO, PTA groups. Maintaining an up-to-date 211 website listing food pantry locations, inventory, and time of last update. Posting multilingual flyers on bulletin boards at international grocery stores. Delivering health information by participating in tabling in Spanish language Zumba classes. Empowering local pharmacists to provide vaccine information to their communities. Enlisting pastors to promote health services during one-on-one or group conversations without the need for printed materials. Recruiting volunteers who share similar experiences with landowners to facilitate wood walks focused on land conservation and management. Creating stickers with QR codes that are attached to coffee cups from the local coffee shops that link health campaign websites aimed at younger audiences. These examples illustrate how strategic, context-informed, and community-partnered approaches make delivering public health messaging more effective in rural settings. Now that we've identified what does and doesn't work when collaborating with rural communities to develop and share public health messages, let's dig a little deeper into what effective communications really means. Effective communication is not just about sharing information. It's about equipping people with what they need to make informed decisions and improve outcomes. In other words, it's not enough to tell someone what to do. We also need to make it clear how to act on that information. This requires more than informing. It requires empowering, connecting, and listening. Before we move forward, let's pause for a moment and reflect. Consider the real-world challenges that might arise when sharing public health messages. What challenges might you face when communicating public health messages in rural communities to support informed decision-making? As you reflect, consider, what barriers stand in the way of meaningful, actionable communication? Are there language or literacy gaps that make your message hard to understand? Do historical or systemic inequities fuel mistrust? How do local values, beliefs, or traditions shape how health information is received? Holding these reflections in mind, let's transition into some practical strategies. To support decision-making that leads to better health outcomes, communications must go beyond what to do and focus on how people understand and respond to information. Here are key strategies to guide your work. Use plain language and visuals. Avoid technical jargon. Use clear, everyday words and familiar visuals that reflect people's lives and priorities. Share relatable stories. Lift up local voices. Storytelling helps people connect personally with the message and see themselves in the solution. A rural public health partner explained the impact of storytelling, saying, "I really think that the impact of storytelling would be what could get to the heartstrings of people. Those compelling stories so they can understand and hear real compelling sound bites from people. And then you package that up with the principles and practices that we're trying to deliver." Another strategy includes emphasize contextual relevance. Tailor messaging to reflect community values and traditions. Frame both risk and benefits in a way that resonates. For example, Daphne Johnson Clark, Public Information Officer at Upper Missouri District Health Unit, described how they integrated art into public health outreach. One of the things that we're incorporating, which is brand new to us, is art in public health. So using art to try to address public health needs. And so we have an ad campaign right now to promote Credible Mind, which is a mental health website that we are sponsoring for our area. We partner with the local artists to use one of their art pieces in our promotions. And so we have an ad campaign running with that, and we're getting really good uptake. So then when we're going specifically to where those younger generations are, we're going to the college, we're going to the work sites where people who are younger are working, and the coffee shops where they drive through. We've got stickers on the coffee cups with the QR code to get them to our website. So some of those strategies work with the younger generation. Dr. Neetu Abad, Senior Behavior Scientist at Centers for Disease Control and Prevention, explains why this matters. You're dealing with a lot of access concerns in rural communities when it comes to health programs and health tools. You could have a lot of mileage between health clinics, and it's not going to be as readily available as in more concentrated areas. Access is a real problem, and so when you're communicating, you have to be sensitive to that. So you can't say, go get this vaccine, or go get this screening tool, or whatever, because you have to understand that for some people, the means are very constrained. And so there are different strategies around access. And I think sometimes our communication strategies are just motivational and not really recognizing the practical barriers that people face. An additional strategy is reinforce autonomy. Communicate options and respect choice. Empower people with information that supports and not dictates their decisions. As one rural partner put it, I think there would be a specific piece of it that talks about listening and how to learn about the community and how to go about finding those people in a community that maybe are the connectors that already know how to communicate in that community. It's very hard to come in from the outside and communicate to a community, and especially when it's one where everybody knows everybody and you're the outsider. Supporting informed decision-making also means inviting dialogue, not just delivering directives. This includes highlighting local solutions and community strengths, offering clear actionable choices and avoiding top-down mandates, creating space for dialogue, feedback, and co-creation, and partnering with trusted messengers who reflect the community. Now, as we approach the end of this course, let's shift our attention to Step 7 of Essential Steps of Strategic Communications, review and revise. While it may be the final step in a framework, it is by no means the end of the process. In fact, Step 7 is integral to every stage of strategic communications. From defining your goals and understanding your audience, to developing a communication strategy, crafting messages, seeking input and disseminating messages, continuous reflection and adjustment are essential. The 7 essential steps for strategic communications is not a linear checklist. It's an ongoing, adaptive, and iterative cycle. As you move through each step, new insights may emerge that prompt you to revisit your original assumptions, refine your messages, or shift your approach altogether. Often this involves a degree of trial and error, testing what works, being open to feedback, and making changes based on what you learn. In rural public health communications, in particular, this means actively listening to community voices, recognizing when something isn't resonating, and being willing to pivot. Flexibility, humility, and responsiveness are critical. The most effective messengers are those who remain receptive to change and committed to continual learning. So as you begin applying what you've learned to your own work, remember this: Step 7 is not a final destination. Keep reviewing, keep revising, and keep striving to meet communities where they are with messages that inform, empower, and improve rural health outcomes. Before shifting to our workbook activities, I want to highlight the Powering Change curriculum. Several portions of today's Lesson 4 content were adapted for the Powering Change curriculum developed by the Population Health Innovation Lab. As we wrap up Lesson 4, let's shift from ideas into application. We're now going to review the related workbook activities, which are designed to help you apply what we've covered to your own work. Before we get started, take a moment to locate the workbook. You'll find links to both a PDF version and a Microsoft Word version in the description below this YouTube video. Once you have the workbook open, here's how to navigate it. Use the table of contents to move between lessons. For Lesson 4, you want to go to Steps 6 and 7 under Applying the Essential Steps of Strategic Communications to Develop a Rural Public Health Communications Plan. Now let's walk through the first activity in Step 6. The first activity, Activity 6A, focuses on identifying communications channels. Building on Rural Public Health Communications Plan you revised in Activity 5. Work with your rural community partners to explore potential dissemination channels for this initiative. Complete the 2 tables provided. After completing the tables, compare them. Are there matches between a list of available channels and a typical day of your audience? If so, these are the channels you should prioritize. Circle the channels you might use. With that foundation, we can move on to the next activity. So the next activity is Activity 6B, Evaluating Communications Channels. Using the channels you identified in Activity 6A, collaborate with your rural community partners to evaluate each channel for efficiency and credibility. Complete the table provided. Circle the channels that offer both efficiency and credibility. These are the ones to focus on in your communication strategy. Finally, let's move to the last activity of this workbook. Our last activity is Activity 7, Review and Revise. Here, you and your rural community partners will continue reviewing and refining your rural public health communication strategy and messaging content, ensuring that it is effective and resonates with your audience. By completing these activities, you'll have a clear path from planning to action, strengthening your ability to implement strategic communications in real-world rural public health settings. Please feel free to pause here and take a few minutes to begin working through the related activities. When you're ready to continue, press play, and we'll move forward into the final part of our lesson. In this segment, we'll reflect on what we've covered and summarize the key takeaways about partnering with rural communities to disseminate public health messages. As we wrap up this lesson, let's take a moment to reflect on what we've covered. We explored Steps 6 and 7 of the essential steps of strategic communication, delivering your messaging and then reviewing and revising it to make sure it really works in your community. We also looked at real-world examples from the field, which helped illustrate why partnering with rural community members is so critical when sharing public health messages. Seeing these examples in action really highlights how collaboration makes communication more effective and meaningful. And finally, we took a closer look at strategies and resources for disseminating public health messages in ways that resonate with rural audience. Altogether, these lessons provide a roadmap for working collaboratively with rural communities, making sure your public health communications are not just delivered, but received, understood, and used to support healthier communities. Before we close, here are the references for the materials and resources we discussed throughout this lesson. In addition to the resources highlighted during the lesson, here are a few more we recommend you explore to help guide your rural public health communications dissemination approach. These sources provide additional context and background should you wish to explore any of the topics more deeply. Thank you for joining us today. If you have any questions or would like to stay connected, please reach out to us at info@pophealthinnovationlab.org or follow us on LinkedIn. We appreciate your time and thank you for participating in this course.